Senate Republicans are pushing for a health care vote next Thursday ahead of their July 4th recess. This is as President Trump says that he is very supportive of the Senate health care bill. He tweeted out his support for the bill shortly after its release on Thursday, saying he's looking forward to making it special. When asked whether the bill meets his standards, President Trump said that it will take a little negotiation, but it's going to be very good. One America's Eric Solomon takes a closer look at the bill and how it differs from the health care legislation already released by the House.
As Obamacare continues to fail many Americans, the highly anticipated Senate health care bill is unveiled. The Better Care Reconciliation Act of 2017 comes 7 weeks after the House passed the American Health Care Act. Just like the first bill, it would overhaul much of Obamacare by expanding healthcare savings accounts, repealing Obamacare taxes, implementing targeted tax credits, and shifting the power from Washington, D.C. to the states. Senate Majority Leader Mitch McConnell says the legislation aims to stabilize the insurance market that's collapsing under Obamacare and provide flexibility to the American people. He calls on Democrats to do their part in passing the legislation.
When legislation does come to the floor, it will present Senate Democrats with another opportunity to do what's right for the American people. They can choose to keep standing by as their failing law continues to collapse and hurt more Americans. But I hope they will join us instead to bring relief to the families who've struggled under Obamacare for far too long.
While the Senate and House drafts have many of the same features, there are some key changes made to the newest version of the bill. One of the most notable changes is the elimination of individual mandates. The House bill allows insurers to impose a surcharge on consumers who purchase a new plan after letting previous coverage lapse. However, the Senate bill imposes no surcharge for those re-entering the healthcare marketplace.
We'll repeal the individual mandate so Americans are no longer forced to buy insurance they don't need or can't afford.
In both plans, the employer mandate would be eliminated, meaning employers with 50 or more employees would not be forced to offer coverage. The Senate bill would give tax credits to people primarily based on age, income, and geography, while the House bill proposed tax credits specifically based on age. In both proposals, those subsidies would end in 2020. Also on the subject of age, older customers would be charged differently under both plans. Both plans allow insurers to charge older customers up to 5 times more for their plan, but the House plan allows states to change the ratio. The Senate bill does not. Additionally, like Obamacare and the House bill, the Senate draft allows children to stay on their parents' plan through the age of 26. One of the most stark differences is pre-existing conditions. Under the Senate version of the bill, insurance companies are not allowed to increase someone's premium or deny them coverage if they have a pre-existing medical condition. That's different from the House bill that allows an insurer to increase someone's premium based on their pre-existing condition if they had a break in coverage. Earlier in the year, the president stressed the importance of pre-existing conditions being a part of the new health care bill.
When I watch some of the news reports, which are so unfair, and they say we don't cover pre-existing conditions, we cover it beautifully. I'll tell you who doesn't cover pre-existing conditions: Obamacare.
Another popular aspect of the Senate bill is how it would change healthcare savings accounts. Like the House draft, the Senate bill doubles how much someone is able to contribute compared to Obamacare. Medicaid has been another focus of repealing and replacing Obamacare. While the Senate bill gives a longer timeline on winding down the expanded Medicaid program under Obamacare after 2020, it also makes deeper cuts to the program. It would also allow states to implement work requirements for recipients of Medicaid. However, just as the House bill, the Senate bill's main goal is rolling back a majority of Obamacare, including defunding Planned Parenthood for 1 year. The president says he's pleased with the plan and looks forward to seeing a finalized bill on his desk, despite a lack of cooperation from the left.
We'd love to have some Democrat support, but they're obstructionists. They'll never support. We won't get one, no matter how good it is, but we will hopefully get something done, and it'll be something with heart and very meaningful.
Eric Solomon, One America News.